Hi, I'm Brad from 1000 Roads. Today we're cutting through the noise and getting to the truth about photobiomodulation, also known as red light therapy. You've probably seen bold claims online. It boosts energy, heals chronic pain, reduces inflammation, helps with skin aging, improves brain function. But what does the research actually say? That's what we're diving into. Whether you're a skeptic, a biohacker, or someone simply trying to feel better, this episode will give you science-backed clarity. Photobiomodulation, or PBM, is a fancy word for what happens when red and near-infrared light interact with our cells, and specifically the mitochondria within our cells, their energy factories. The light doesn't burn tissue, instead it stimulates cellular processes. The key target is cytochrome C oxidase, an enzyme in the mitochondria that absorbs red and near-infrared light. When it does, that causes your mitochondria to increase oxygen demand and therefore produce more ATP, the energy currency of life. That's why red light therapy is often described as cellular recharging. It's not magic, it's photochemistry. Red light doesn't just shine on your skin. It triggers your mitochondria to make more energy. More ATP means better healing, faster recovery, and less inflammation. That's the power of photobiomodulation. Let's talk results. There are now over 7,000 peer-reviewed studies on PBM, and the data is very compelling. Let's break it down into categories. First, let's talk about inflammation and pain relief. One of the most studied and consistent findings is PBM reduces inflammation and chronic pain. A 2017 meta-analysis in The Lancet that reviewed 49 randomized controlled studies found significant pain reduction across conditions like osteoarthritis, tendinopathies, neck pains, and much more. A landmark paper titled The Laser Therapy of Rheumatoid Arthritis confirmed that PBM reduces pain, morning stiffness, and joint swelling in rheumatoid arthritis patients, highlighting it as a potential non-invasive adjunct for autoimmune joint pain. And the effect isn't limited to chronic conditions. Even short sessions can bring fast relief. For example, a study called The Assessment of Immediate Pain Relief with Laser Treatment in Recurrent Aphthous Stomatitis showed rapid measurable pain reduction after just one session. How? Red and near-infrared causes greater cellular oxygen demand while stimulating circulation to increase oxygen availability. Research is clear that inflammation requires low oxygen environment in order to exist, and red and NIR light reduce oxidative stress and they lower pro-inflammatory cytokines by quenching this oxygen starvation. Less inflammation means less pain without side effects of medication. Number 2, wound healing and tissue repair. Studies going back to the 1990s and continuing today show that PBM speeds wound healing and enhances tissue regeneration. Think things like post-surgery recovery, muscle strain, ligament injuries, even diabetic ulcers. These are areas where red light therapy has shown measurable improvements by giving the cells the energy they need to produce more collagen and the tissues they need to repair. Number 3, brain health and cognition. This is where it gets exciting. A 2019 review in photobiomodulation, photomedicine, and laser surgery looked at transcranial red light therapy. That's light applied to the head, and found a significant improvement in cognitive performance, in mood, even some symptoms of neurodegeneration with early Alzheimer's. The mechanisms? Well, light penetrates the skull and stimulates mitochondrial activity in the brain cells, increasing cerebral blood flow and reducing neuroinflammation. Yes, studies show near-infrared light boosts brain energy, increases blood flow, and even helps with memory and focus. The science isn't fringe, it's quickly emerging. Number 4, skin and anti-aging. Let's not forget skin. PBM increases collagen production. It reduces wrinkles. It improves skin tone and helps clear acne. And all of this is supported by clinical trials. One 2014 study in photomedicine and laser surgery found that red light therapy significantly improved skin complexion and collagen density in just 12 weeks. Again, it's not light at the surface, it's what's triggered deep inside the skin cells. Now let's be real. Photobiomodulation isn't a miracle cure. It won't replace healthy habits, and despite what some influencers might say, it's not going to give you superpowers. Here's where the research is still more early stage. It's more early stage when we start talking about significant weight loss effects or reversing neurological disorders. But there is some promising early work into retinal and vision health, especially age-related macular degeneration. That last one is really exciting. Red and near-infrared light appear to support the mitochondria in the retinal cells, with early human trials showing improved vision function in older adults. But again, more research is needed before PBM becomes the frontline clinical tool. There's potential, but we respect the difference between evidence and hype. Red light therapy won't replace sleep or clean nutrition or movement. It's a powerful tool, but it works best as part of a bigger picture. Use it to amplify your health habits, not to shortcut them. Here's something most people don't talk about. Dosage matters. Just like supplements or medication, red light therapy works best in the right dose. Too little, no effect. Too much, it can actually reduce the benefits. This is called the biphasic dose response, a foundational principle in photobiomodulation research. That's why using high-quality panels with consistent irradiance and wavelength coverage is essential. Look for, at a bare minimum, wavelengths in the reds of a range of 630 to 670 nanometers, and infrared in the range of 810 to 850 nanometers in wavelength. We also include a less frequently offered wavelength, 1060 nanometers, which penetrates deeper and supports brain health, joint inflammation, circulation, and nerve regeneration. In fact, there are some interesting studies on dementia improvements with 1060 nanometers. You also want to have high output so you get effective dosing without unnecessarily long sessions. However, don't get yourself trapped into thinking higher output is the most important factor. Most people won't notice the difference between a 9-minute session or an 11-minute session. Next, I would look for a dual chip LEDs for broad spectrum delivery. Dual chip allows each LED to deliver both red and NIR wavelengths so that you're getting even coverage of both. Lastly, no unnecessary EMF exposure. Our units have no EMF at the recommended treatment distance of 6 to 12 inches. That's why we built them the way we did. So what's the bottom line? Photobiomodulation is one of the most evidence-backed wellness tools available today. It works by charging your mitochondria, reducing inflammation, and triggering repair. It's not hype, but it's also not a shortcut. It's a tool. And when used consistently and correctly, it can be life-changing. If you want to try photobiomodulation at home, we've built one of the most science-aligned red light systems available. We have taken the broadest set of wavelengths with deep research and combined them into a single, affordable unit designed for real results and real people. To learn more, download our free guide below and start using it with purpose. And if you're already using red light therapy, drop a comment and let us know what results you've seen. We read everything. Thanks for watching, stay curious, stay committed, and I'll see you on the road to healing.